We will go ahead and get started. Good afternoon, everyone. Welcome to the Community Foundation of Broward's very first virtual Food for Thought experience. I'm Sheri Brown, your Vice President of Community Impact here at the Community Foundation, and we are so delighted that you joined us this afternoon. These opportunities are how we keep our promise to keep you informed, connected, and engaged on the critical issues affecting our community. These are the issues in which we invest our time, our leadership efforts, and our grant dollars. We give you the inside scoop on these big issues with local and national thought leaders, including the Foundation's expert team. Hopefully, we will be able to do these talks in person sometime in the near future, but for now, safety is our priority during this pandemic. On our panel, we would like to introduce to you our new incoming CEO, Dr. Jennifer O'Flannery Anderson. We are so excited to have her join the foundation, and I would like to allow her to give a few words if she would. Jennifer?
Sure. Hi, Sheri, and hi, everybody. Good afternoon, and it's so nice to be with you. I know we have many fund holders, board members, nonprofit and foundation partners on the Zoom today, and I want to thank you so much for taking time to be with us. We're trying to adapt to this virtual world like everybody else, and so we appreciate you trying it out with us. We know that these issues that matter are important to all of you, and we want to start sharing some really important information about our work throughout the community. And today we really want to talk about the issues of economic independence and what is happening and how you can help more and what our partners are doing in the community. So thanks for letting me give you a little welcome, and I can't tell you enough how excited I am to join the foundation and to follow in Linda's legacy and footsteps. They're big ones to fill, and I'm looking forward to the challenge, and I will be so proud to work with such a great team of professionals and board members and volunteers. So I start on August 17th. I'll be in the office, and I'll look forward to speaking with you then, but you can, and I even have an email, joa@cfbroward.org. So feel free to email me, and I'll look forward to seeing you, hopefully in person soon. But thank you very much for all your support and for letting me be a part of today. Thanks, Sheri.
Awesome. Thank you, Jennifer. We so look forward to your starting date. There's so much we have to accomplish here at the foundation, and we're delighted and just so excited to have you join the team. So today's conversation is a hot topic. Where are Broward's jobs? With all the headlines that you all are reading about the rise in unemployment and people waiting for benefits, and with our community in an economic tailspin, it's really hard to see the light at the end of the tunnel. 73% of South Floridians are struggling economically as a direct result of the COVID-19 crisis. And with so many reporting that their finances are deteriorating rapidly, it really begs the question, how do we get people back to work? Many of them are making trade-offs on essential items like food, medication, and rent. And in addition to the financial problems, our local 211 helpline is seeing a record number of calls for other problems that people are experiencing, such as mental health crises, food insecurity, and suicide-related issues. These are all side effects of the pandemic and the stresses that come upon people when they lose their jobs. And people want to get back to work, but in many cases, their jobs no longer exist. Just by way of history, we launched the Economic Independence Issue That Matters about 4 years ago with an aim to give people a hand up instead of a handout. And up to the start of the pandemic, the foundation had helped over 1,000 residents seeking economic stability gain employment, obtain a GED or other trainings and certifications, and secure stable housing. Well, the landscape has changed drastically in just a matter of months. And the pandemic, along with the overlapping social and racial justice issues, shine a bright spotlight on the economic inequality that exists. And the lower income workers have been the hardest hit. So this caused the foundation to concentrate its focus on employment, because if people have a job, then they have financial ability to take care of other needs that they may have. Through a partnership with the Greater Fort Lauderdale Alliance and others, we're putting our effort on steroids to broaden and deepen our impact to help residents get back to work. We hope by the end of this session, you will see ways that you can join the foundation to make a bold impact to help this community that you love so dearly. And with that, I'd like to introduce our moderator for this afternoon, Vice Chair of the Community Foundation's Board, Juliette Murphy-Rowlett. Juliette, I think we all know her, is the Regional Manager of Corporate External Affairs for Florida Power and Light, FPL. She is a lover of Broward County and is demonstrated through her various involvements throughout the community with the Fort Lauderdale Chamber of Commerce, the Broward Workshop, the Museum of Discovery and Science, Baptist Hospital, and the Greater Fort Lauderdale Alliance, where she serves as the current chair. And so this issue is very near and dear to her. So with that, I turn it over to you, Juliette, to moderate our panel.
And thank you so much, Sheri, for framing our conversation so very well. Good afternoon, everyone, and greetings on behalf of the Community Foundation of Broward Board of Directors. I am pleased to be part of this organization, and I particularly love this food for thought, where we have the opportunity to connect, learn, and explore. Today, we have three wonderful subject matter experts who will not only share their expertise and facts, figures, and the real deal about what's going on related to this COVID crisis, but they will also be very candid. So I really look forward to hearing from them. We have three panelists today: Mason Jackson, who's President Emeritus of the Career Source Broward. And President Emeritus means that he is actually recently retired. So we are lucky to have him because he has a lot of information for us. Then we have Dr. Germaine Smith-Baugh, who is the President and CEO of the Urban League of Broward County. And she serves in a great number of our local population and will have a lot of information about how it's really impacting underserved communities. And then, of course, Dr. Ted Greer, who serves as the CEO of Hope South Florida, who very much supports the community of our homeless. So with that, I would like to give you a few instructions on how we'll proceed. So each panelist will have 10 minutes to share their thoughts, and after they speak, we will open up to Q&A. At that time, we will take your questions, and I'll give a few more instructions at that time. So let's get on with it, shall we? First, our first speaker is Mason Jackson. Mason is President Emeritus of Career Source Broward and has been involved in workforce development programs for over 40 years. He has served as the chair of the Greater Fort Lauderdale Alliance's Governor's Council and president of the National Association of Counties Training and Employment Affiliate Board of Directors. He is also the founding president of Broward County's Juvenile Justice Board, a charter member of the U.S. Department of Labor's Enterprise Council, and a certified workforce development professional. Well, if you didn't know he was certified before, you will believe it after you hear from him. So let's get started, Mason. The floor is yours.
Well, thank you, Juliette, and thanks to the Broward Community Foundation for having me on today. I don't know if I'm certified, but I'm certifiable at times. And I always shrink from the title of expert, because if you take the word apart, you got X meaning from, and spurt is a drip under pressure. So I'm always worried about that. First, a short commercial. Career Source Broward is federally funded but locally controlled by a public-private partnership of elected officials, the private sector, education, economic development representatives, community-based organizations, and organized labor. We operate the 3 one-stop career centers in the community where people go to find jobs and businesses go to find talent. Everyone can avail themselves of some level of services, with higher levels determined by need. We also help businesses find the talent they need. In fact, we consider the employer as our primary customer. All of our services are prepaid and at no cost to the customer. We serve about 60,000 people a year and about 7,000 to 10,000 businesses. So, unemployment. First, we have to recognize that we may be in the worst job market since the Great Depression. Although the unemployment rate is 11.8% for June, down from 16% in May, don't be fooled. The drop probably represents the partial reopening of Broward during the month of June with businesses and restaurants. And I suspect that the July rate will creep back up toward the 16% again. But however it fluctuates, it's important to remember a couple of things. First, the unemployment rate doesn't count the discouraged worker, those who have simply stopped looking. And they can stop looking for a number of reasons. It also doesn't count the marginally attached, which means those are people who were working part-time. This is particularly true in the hospitality and tourism industry, where a person might be working 2 or 3 jobs. They would like to be working full-time, but in fact they are working, trying to make ends meet, being marginally attached. So they are in fact employed, but not employed at a self-sustaining place. The unemployment rate, by the way, is not based on those getting unemployment assistance. So when you see those numbers, those aren't necessarily the numbers that go into the unemployment rates, derived completely differently. To be counted as unemployed, you have to be available and looking for work. So why would people not be looking for work? Well, lots of reasons. Sometimes they're just discouraged in an emotional sense. They've been turned down so often that they don't want to go through that again. Or because they don't believe there's a job out there for them in their industry or even across industries. Or they can't work because of the lack of childcare, or they're taking care of dependent parents, or even in some cases, fear of contagion. So when they say, are you looking for work? Some people say, no, I'm waiting this one out until we get a vaccine or something along those lines. So they're not counted as unemployed for the purposes of these numbers. So, and some are even waiting it out to see if they can go back to their previous employers. They're not seeking for that. They're not seeking employment because they're waiting for that callback. And we see evidence of this in the drop in the labor force. Traditionally, Broward has about 1.1 million in the labor force, and it's down now to about 244,000, a drop that is almost twice the number of unemployed people that we had in February of this year. So that indicates that people are not in the workforce, they're not looking. And the worst is not over because the pandemic is not over or contained. Many businesses are closing for good. The Miami Herald cited Yelp yesterday and reported that there are almost 3,000 businesses that have closed in the Tri-County area since March the 1st, from March to July the 10th. 2,000 of those are marked as permanent and others are teetering. Many small businesses will not make it. There are estimates that some small businesses will close, 25% of the small businesses will close for good. And therefore, there's no job for a person to go back to. And here's another point to keep in mind. Unemployment is not, and never has been, evenly distributed amongst all races, ages, and education levels. It's an average. So, for example, if you're a white, college-educated male, the unemployment rate may be half of the stated unemployment rate. And if you're an 18 to 24-year-old minority male, a dropout, or only a high school diploma, then your unemployment rate could be 5 to 7 times the stated unemployment average. So in every average, there are rates above and below the average. And further, the rates are not evenly distributed geographically. In Broward, job loss has disproportionately affected the low-income wage earners because the pandemic disproportionately affected the tourism and hospitality industry. But I'll defer to Dr. Germaine Smith-Baugh and Dr. Greer for more comments about the disproportionate impact on some parts of our community. So I'd like to stop there and allow the other panelists to go, and then I'll have some comments about where the jobs are and what we're seeing in terms of trends, and then maybe perhaps after that, some suggestions about what the Community Foundation can do.
Thank you. Thank you so much, Mason. You know, a couple of things really stood out that it's predicted that 25% of our small businesses are expected to close. Meanwhile, we are seeing, you gave us a cautionary note to watch the improvement of the employment rate. So we look forward to talking more with you about that.
Sure.
I'd like to also at this time say welcome to several of our board members. who are on the phone, and particularly to recognize James Donnelly as the chair of the board, and Ed Hashik, who has the responsibility of chairing the Issues That Matter committee. And of course, this economic independence is one of those issues that matters. So thank you for joining us, and thank you for working with us always for the good of the community. So next we move to another wonderful speaker, and that is Dr. Germaine Smith-Baugh. Dr. Smith-Baugh is CEO of the Urban League of Broward County, which is a nonprofit organization dedicated to elevating the standard of living for families in underserved urban communities. In 2006, she was appointed as the only woman to lead an Urban League affiliate in Florida. And she is credited with several achievements, including the opening of a $9 million community empowerment center located in the historic Sistrunk community. I think that effort actually caused her to be known as a visionary, because that vision was well ahead of anybody thinking it were even possible. And I remember her walking me through with a hard hat tour. So Dr. Smith-Baugh, thanks for your vision, and we look forward to hearing from you. Please tell us what you have to share.
Thank you so much, Juliet. I truly appreciate the opportunity to be with everyone here today. Mason, you're always a hard act to follow. You know, we're gonna have to work on this order next time. So again, to the Community Foundation, investors, fund investors, to your new president and CEO, Jennifer, it is absolutely my pleasure to be here. So a little bit about why I thought this conversation was important and the reason why we wanted to be, I wanted to be a part of it when asked. I'm gonna ask a question, Juliet. Am I resounding in any way?
You sound great to me.
Okay, all right, just wanna make sure. So when we talk about economic independence and why this issue matters, that goes directly to the heart of why an Urban League exists in our community. So there are close to 90 Urban Leagues across the United States, 7 in the state of Florida. And your Urban League here in Broward County has been a part of this community and this ecosystem for this is our 45th year. And I believe, you know, when you think about why we exist, simply put in the previous mission statement, but you know, we all complicate mission statements now. It simply would say to promote economic and social equality. That's what it used to say. Now it has a whole lot more words in there. So when you talk about economic independence as the Community Foundation, when asked, I definitely wanted to be a part of this conversation to give at least a perspective from the Urban League. So majority of the individuals that Urban Leagues serve are living in urban communities, predominantly minority individuals and low to mid income individuals. Urban League tends to look at issues from the lens of being African American or Black in communities. We serve anyone that comes to our door, but when we look at facts and figures, that's the lens in which we will compare everything else to. So when we think about this virus and COVID, you know, we all recognize from the reports that we have seen or read or heard that Black people are more likely to contract this virus primarily because of the environments in which they tend to live, as well as the comorbidities that tend to exist for them from a health perspective. Whether you talk about multifamily housing, multi-generational households, and denser metro areas in which even within our community, African Americans tend to live. Most Americans, when we think about unemployment or employment on a whole, most Americans receive their health insurance through their employer. So when we think, to your point, to Mason's point related to the high rise of unemployment, in the midst of a pandemic for minorities, that means that these families are probably going to be foregoing the preventative care, or even worse, forego the emergency care that would come with issues related to the coronavirus. And an unprecedented number of people, and I understand from data, more than 16 million have already filed for unemployment between March and April, and of course that number is just even higher now. The other thing that we are seeing and anticipating as we move forward in our current ecosystem is that with the eviction moratorium being lifted in Florida, we anticipate, and I'm sure Dr. Greer will speak to this issue, we definitely anticipate a flood of evictions and probably more than likely a rise in homelessness, especially for those families who have been laid off and or their hours drastically reduced. And because, as Mason said, low-wage employees tend to have been mostly impacted during this time. And when we think about who those low-wage employees are, they tend, frankly, to look like me and different versions of my color. And we have to recognize that Black workers were already twice as likely to be unemployed than their white peers, regardless of their qualifications. But Black workers will likely experience higher rates of unemployment as a result of this crisis and see more of those jobs impacted in the near and the long term. And then to the point of the small businesses being shut, being closed, and some to the point of permanently closed, that number even seems more drastic. Just a couple of other points. In a March 2020 survey of American households, 22% of Black respondents said that they or someone in their household had been either laid off or lost their job because of the coronavirus outbreak, which was compared to 17% of white respondents. Another 28% reported that someone in their household had either taken some level of a pay cut or reduced hours or a demand for their work because of the coronavirus outbreak, compared to 23% of white respondents. So while this crisis will likely result in a disproportionate number of people being unemployed on a whole, it will definitely have a severe impact on the Black Americans' unemployment rates. And we also should consider the fact that it will be undercounted to some degree. For instance, workers who are placed on unpaid leave, and actually Mason pointed out even how the unemployment rate, and I'm sure for many that was right there eye opener in terms of when you think about the numbers and how it's counted. But even when we think about the undercount, workers who are placed on unpaid leave, who have their hours involuntarily reduced, or who might lose one or two of their multiple jobs, they won't be counted in the unemployment rate or being unemployed. So even before the pandemic, lower unemployment rates did not significantly decrease the number of families and individuals living in poverty. Many people were working multiple jobs in our county just to be able to make it through. And we know from the United Way's reports that the number of people who are employed but still constrained in their called ALICE folks and families, they're close to 48% to 50% of the people who live in our county. So we have to recognize the fact that we are going to see higher levels of poverty, and the impact of what that will have, within our county had already been seen before, and just will be exacerbated by what we're experiencing today. And we also have to think about the gig economy, the level in which many of our families were working in that economy that is no longer going to be there for them to really be able to supplement their respective incomes. The last point that I also want to make is when we think particularly about minority communities and the way in which the workforce or the issue of a job gives people a sense of independence, is the idea of how quickly we lose it. And unlike many of us who might be on this call, definitely the panelists who are on this call, where we had options related to the way in which we could continue to work, Many individuals within our community, particularly within low-income minority communities and families that are struggling before, it is just continuing to pile on. And we're going to talk a little bit more about that in the questions and answers. But that just gives, I hope, a picture of where we are today related to the challenges, particularly for minorities within our community, and ensuring the fact that we're thinking about this issue very holistically. I often say, and have shared with folks, and I'm sure you've probably heard this too, if I'm not in your imagination, I can't be in your future. So when we're reimagining what the future of Broward looks like, and when we talk about that some more in this conversation, we got to really make sure that we're thinking about the way that it is now, and the way and the impact that it has, and the way that it needs to be reconstructed, taken a new look at in the future. So thank you, Juliet. Juliet, I think you're muted.
I am. Thanks for that. Yeah, as you were speaking, it just really illuminated the idea that we do need to look beyond the unemployment numbers that we're seeing, because the disparities that you have just noted, Black workers 2 times more likely to be unemployed than the majority population. Those are indicators that even under normal circumstances exist, so we know that it is far more significant. Thanks for giving us that insight, and we will look forward to more conversation about that. So now we move to our third panelist, and that is Dr. Ted Greer. So Dr. Greer serves as the CEO of Hope South Florida, a leading faith-based organization serving the homeless population, families, and veterans in Broward County. He previously served as the CEO of the Center for Family Services of Palm Beach County, an outpatient behavioral health organization and housing program for homeless families in Palm Beach. He has had an extensive career in behavioral health, child welfare, homelessness, and youth and family services, and more than 24 years as an ordained member of the clergy. We're happy to have him down in Broward County serving in this capacity, and we know that he's compelling because he compelled myself and FPL to make donations to Hope South Florida as he sat across from me one day. So Dr. Greer, thank you for being with us today, and we look forward to hearing from you. Thank you.
Thank you for having me. It's my honor. Can everybody hear me?
Yes.
Can everybody hear me? Oh, great. Thank you for having me, and I appreciate the foundation inviting me to participate in this important conversation. Yeah, our focus obviously is the homelessness community, particularly homeless families and veterans. Prior to COVID, it's a challenge enough to secure employment, to retain employment for homeless persons. And now with the virus, it becomes more of a challenge. So we find ourselves have to pivot real quickly to find employment on a home base, because frankly, with a lot of the hospitality, limited employment right now, even some of the major retailers, we have about, I think we're approaching about 30% of our people are now unemployed since COVID. They have lost their job from operations, from, as I said, the hospitality industry. So we find ourselves finding a way without the support from foundation, from the community foundation. Most homeless organizations, most nonprofits, focus, or their mission is not tied to employment, do not have the infrastructure needed to make sure that we can help access employment for the people that we serve. So what not for the foundation, frankly, who provided us a grant, we are now able to hire one full-time position that's focusing on obtaining and retaining employment services for the people that we serve. And as Germaine mentioned, Dr. Brown mentioned earlier that because of the current moratorium on eviction, we have a break, a little time to work hard to find opportunities in our local communities before the moratorium is lifted. We are going to have a crisis. I think we're going to see more of a homeless issue, not only in Broward County, but across the country. Because frankly, people who are experiencing a moratorium right now, they have not paid their rent or mortgage in 3, 4, 5 months. And then on top of that, not having reliable employment makes it quite a challenge, double the challenge that we're seeing with our population that we're serving. Couple of the challenges that we continue to see with our people, what makes it difficult is one, transportation issues, criminal background, not having an educational background makes it even more of a challenge right now as our employment specialists, as our case managers, our program team, we're knocking on doors everywhere possible to secure employment. And so with COVID, employers are looking for more qualified people with the background, with experience, with the education, with the expertise that they want. Homeless persons that we serve typically have those challenges to meet those demands. So we're working hard to trying to find ways to pivot to, as I said, home-based businesses, opportunities where we can employ our people through working from home. And that brings up some other challenges, but we're finding a little window open to employ the homeless. We have to first address at Hope South Florida more immediate needs right now. People are hungry. Food insecurity is off the roof. We're feeding 500 people a night right now. Prior to COVID, we're averaging about 200, 175 to 200. We're averaging about 500 persons a night we're providing hot meals to. And that's just not street homeless. That's our neighbors who, as a result of COVID, they too are unemployed, they too are hungry. So we're finding that neighbors and homeless persons side by side, standing in a line, waiting to get something hot to eat. And mobile showers is another one. We have one shower unit, it has 6 units attached to it, and we're wearing it out because of the need. The numbers are just climbing. So my concern, our concern, once the moratorium is lifted, the eviction moratorium is lifted, we're going to see more of a crisis. Our board of directors and our team, we're working hard to get ready to see what we can do to help mitigate a street crisis, particularly as it relates to homeless families, children who are still today sleeping in cars, in parking lots. We have a great relationship with the local Walmarts who call us, as opposed to calling DCF. They call Hope South Florida, please, we see a family here sleeping in our parking lot. Rather than calling DCF so that the kids may be separated from their families, that's enough trauma. They call Hope South Florida, so we send a team out and we try to engage as quickly as possible. So there's still families sleeping on the streets who are still hungry, who are still not having the basic necessities in terms of healthcare that Germaine talked about, access to quality healthcare. And that's something we're trying to do at Hope South Florida, to create a wellness program where we can help homeless families and our veterans, frankly. Our veterans are struggling tremendously in terms of their mental health issues, as well as employment issues. So I'll leave it at there, and I'll be happy to answer any questions.
You're on mute again, Juliet.
It's remarkable to me how much we see it and we know it, the issue of food insecurity. But to hear you give the example of an almost 400% increase in your need to feed your community is really startling. And it's information that we really need to understand and know. So thank you for that. So it's now that we have the time to ask questions of this panel. There's certainly a lot of interesting information that's been shared. And I think I'd like to start with a general question that would probably apply across the panel. So whoever wants to take it first. And that is, as all of you, I'm sure, have been dealing with many unique and interesting and powerful stories of individuals that you've been serving. And I just wondered if each of you could share an instance of an individual, a family, an instance where either you through your services or philanthropy helped make a difference in their life as we've gone through this COVID experience.
Juliet, may I just start on that? It's not a specific person, but as everyone who newspaper knows, During this pandemic, the reemployment assistance system, the unemployment compensation system for the state of Florida failed miserably. And because of it, thousands of people were left without income and for long periods of time. There are some that filed in March that still haven't gotten it. Without the community supports that are out there, people would have been without food and possibly shelter. And so even though there was a moratorium on evictions, they tried to pay and so forth. I think that we saw thousands and thousands of people in Broward having to rely on the not-for-profit community to help them make ends meet while the gears at the state level turn slowly.
Thank you for that insight and what you've noticed there. It is quite discomforting, to say the least. Anyone else have something to share?
Yeah, I'll share. And this is really going to, and I think we need to mute our phones. So I think I'll share this because I believe it's important, particularly for those who may not necessarily work directly, but you support the work, is to understand the intersection of the work. So I'm going to give an example of, and I don't even know if Ted knows this, but of the way that organizations work together to do exactly what Mason talked about, like to address this. So we had a family that was a mother and her children that were living in a car. They came to the attention of my staff through, because she had a baby under the age of 1 and we run maternal health programs. So they were trying to figure out how to address this particular issue. And the way that the mother chose to address it was that she was willing to sleep in the car, and the father of at least 2 of the children, she had 3, 2 of the children were willing to allow the children to sleep in the house, but she couldn't sleep in the house. So she stayed in the car every night while the children slept in the house. Now, as a mother myself, I really, you do what it is that you have to do in order to ensure the fact that your children are fine. But we also recognize that there were some mental health issues. We recognize there might have even been some substance abuse issues and, you know, a few others. So when it was brought to my attention, because navigating the immediate system wasn't working very well for my staff, I immediately called over and got in contact with Hope South Florida, their team, the pastors that actually support, you know, the work that you do, Dr. Greer, and we were able to stabilize her children, connected her to OIC of South Florida for some direct training related to work training, workforce development training. The list can go on from there in terms of the way that we supported her. But I think what is important in this example is to understand that that example is now on steroids. And the idea that we have families with these multiple issues that were at one point stable, that are teetering on being unstable, or just not, you know, or just really off the brink at this particular point. So one of the things that we really do have to think about is the comprehensive way in which we're going to be addressing the needs of families from the various aspects in which any healthy family needs to be able to address all the various needs in their respective.
Yes, if I may. Also, there's we have a couple of families, a couple of moms, I should say, who have experienced either as a realtor who are homeless, but was previously a realtor, or we have a pharmacist assistant, we have a property manager assistant, those type of positions, those type of professionals who, as a result of domestic violence related issues or other issues, are now homeless. And so we find ourselves, so they lapse in terms of their credentials. They must be certified in these respective roles. And so we find ourselves have to go the extra route to help them acquire their license or whatever credentials that they need. And this is where I said that Community Foundation was a blessing to Hope South Florida in terms of providing the resources that we needed so that we can provide this level of support to the people that we serve. Because this becomes a barrier. You have qualified people who, as a result of issues in their lives, who are homeless, but don't have the resources to get back to be gainfully employed. And so the success that we're seeing now because of the support of the foundation, as well as others, it's so exciting to see people back to work in their respective role. Just recently, we had someone went back as a property manager assistant, working for a local condominium here in Broward County. That if it was not for that resource that was available, that we can help her get access to taking the tests again, and now she's back to work. The same thing with a realtor. We had a firefighter, ladies and gentlemen, there was a firefighter that was homeless because of some personal issues. To see him back to work is exciting. So it's going to take that type of collaboration, working together. I appreciate the story that Germaine just told. We're working with everybody as much as possible. The Urban League has been a resource for us as well. OIC is a tremendous partner. We have to find ourselves to work in a collaborative way to address this issue. And as I said, as we approach the lifting of the eviction moratorium, we're going to have to work even more closer together because we have a challenge up ahead that we must be ready for. The only way we're going to succeed is this type of collaboration, working together, and getting the resources that we need to make it happen.
Yeah.
Thank you.
Thank you.
Juliet, it's also true that the people who come to us who have barriers to employment or are seeking training for a job often need a lot more than just the training. They need housing assistance, they need utilities assistance, they need they need food support and so forth. So 211 is on the speed dial for all of my success coaches that work with people in the community who have barriers.
Yeah. So, yeah, thank you for that. You know, one of the two takeaways from your comments collectively is that this is certainly, there's no bias as to how and who this pandemic impacts our community. And there has to be a holistic approach to the multifaceted symptoms, so to speak. And the second is that, you know, as Dr. Greer mentioned, it affects anyone, right? There's just no telling, no demographic that hasn't been impacted either by the disease itself or the ripple effects that we've seen. So we have another question from the audience, and that is, and this is maybe somewhat controversial. So as we know, Florida has one of the lowest unemployment benefit rates in the nation. That has somewhat been resolved with the federal government paying out the flat $600 for an unemployment benefits for the short term. However, what we've seen is that there have been some impacts because of the fiscal cliff issue. That is, earners who would not be making as much as $600 had they been working are now earning more or getting more because of the unemployment benefits and the impacts that's having. Any thoughts on how that will all roll out and the long-term effects of that, short-term and long-term effects of that?
Well, I have heard that many times, both from the business community and from people in the community. If people are actually doing that, and I don't know of any specific circumstance where that's happening, even if you combine the meager benefits that you have under the state's reemployment assistance program with the $600, and if you did that for a year, and we all know that that $600 was time limited, okay, then even if you annualize that, you're still $10,000 under the average annual wage in Broward County. So anybody that's doing that and thinking about not taking a job is being very short-sighted, because if that employer needs somebody to recall you and they need for you to come back to work and you don't do it because you think you're going to earn more money in the short term, well, you'll be without a job because they'll hire somebody else. And it also doesn't take into account that some of the employers out there are paying benefits like health care and so forth. So you're foregoing the health care for a very short-term benefit. So while there is that danger that you're incentivizing unemployment, the real problem is that we just don't have enough jobs out there. And we need to be focusing our attention on job creation and job diversification so that there are jobs for those people to go back to.
Yeah, I agree with, I agree with Mason completely. I saw the question in the chat. It is definitely a conversation in the universe. I don't know of anyone who is taking that pathway. At the Urban League, we are, excuse me, at the Urban League, we are very direct to lay it out just the way that Mason laid it out, but we put it in numbers so that people are very clear about why that is not a good idea, right? So you see the visual of it in case you were thinking that, because again, there's a lot of chatter, and that's one. But to Mason's point, as a community of employers and leaders, we need to be focused on job creation. If 3,000 businesses are closing, and I think I got that right in terms of what you said, Mason, what was referenced, are closing in the Tri-County area, and 2,000 of them may be permanent, what that equates to in the number of jobs is staggering over time. And then you couple that with what we now term, the fourth industrial revolution of automation, and what's that going to do to low wage, low income, and low wage earning individuals, is really an intersection that as a community we really have to think about. And not, it's a great question, and I think we've given our thoughts and feelings about it, but I want to caution us not to get caught up in the chatter and to be focused on how we're creating jobs in this community across the board so that people do go back to, or do have the opportunity to go back to work or be retooled, educated, or whatever is necessary for their families to survive.
Thank you for that. Ted, while we're on this issue of unemployment, have you seen an increase in how many homeless are in fact employed? They're underemployed. Have you seen any increase in unemployment rates, particularly with your homeless population that you serve? And what is it?
Yes, as I said earlier, I think 30% of our homeless families are now unemployed. And to what Germaine just said, I want you to know, and because there's a perception that the homeless don't want to work, and it's quite the opposite, particularly those with children. These moms and dads, they do want to work. They don't want to hand out. They want to hand up. And so any way we can find to help them secure employment, that's our mission, that's our goal. So yes, we saw about 30% in the last 3 months who've lost their job, who are aggressively pursuing. As I say, some have even shifted their profession, their focus, and because some are a little nervous about working in the midst of this virus, so they're looking for opportunities where they can work from home. And so some of the challenges with that is that they need access to the internet, they need a laptop, they need a telephone. So that's a new area that we're finding ourselves trying to assist these families who may secure employment, that they're able to work from home from the healthcare industry. Some of the call centers are hiring, the HMOs. And so, but our team, our clients don't have the resources to purchase the equipment that they need or even to access the internet. They do want to work. More of them are losing their jobs as business closes. They're losing their employment opportunities. So we're trying to stay in front of that as much as possible.
So you bring up yet another ripple effect. It's amazing to me how much I didn't know. So you're right, in terms of the need for technology, for equipment, for virtual interviews, to even search for jobs, that is something that certainly would be diminished opportunity for the population you serve. Okay, there's so many challenges, so many challenges.
And Juliet, can I just add also the notion that it's not just job creation, it is diversification of our job base. If anything, this coronavirus has shown us our dependence on hospitality, tourism, the cruise industry, the airports, and the cruise ports, and so forth. We need high skill, higher wage jobs in the community so that we're not so dependent on any one industry.
Thank you for that. So, Germaine, I know that the Urban League has long served a very fragile and underserved community. Any surprises or learnings for your organization as you have continued to serve this population during this COVID pandemic?
I wouldn't say that they were necessarily surprises, but so this year marks 24 years that I've been with the Urban League, and I have to tell you that this is the moment, the crossroads, where I was like, now or never, in thoughts that I've had related to the way that we serve, right? So not so much surprises, but more, we have to figure out a way that we are addressing the resiliency of families. And that issue of resiliency, economic resiliency, mental resiliency, because every family, every being, if you're going to be on this side of the green grass, is going to run into something. The opportunities that we have, majority of us on this line, is that we have coping mechanisms and support systems and so forth that allow us to bounce back in a way that may not be as obvious. The strain is not as obvious to other people. We may not need to seek resources outside of our families or the like in order to be resilient. And I think for us, the learning has been one, that we serve people and we have served families. I can't say that we haven't, but we need to be more integrated in the way, like our service integration needs to be a model of service, not a program. So it's something that I've always known and felt as a social worker, wanted to do it at the Urban League. So we've actually restructured the organization to really look and triage families so that we deal with families of higher need in a different way, not just the child who is in our after school program, but what else is going on within that family unit. So we are reworking our service integration model. We're calling it Links. And I make it clear that it is not a program. It's a way in which we do business. The second thing that we've decided, or really bringing more to the forefront, is something that Dr. Greer said. We've always worked very closely, CareerSource, Broward, you could list them, all the organizations. There's not an organization that we have not worked with. But we need to get really clear about what the exchange is. Like, how are we ensuring the fact that it is not just that one staff member that knows what to do with Hope South Florida or with CareerSource, that it is something that runs across the organization. And then even looking at those organizations, the thought that we have right now, looking at those organizations that we work heavily with, that we have point persons within those organizations and they have a point person within our organization. So it is not a matter of navigating through, a whole bunch of phone calls, that if you fall in that category. So I would say the learning is, how do we pivot our service delivery to put the lived experience in the middle and not it being convenient to who we are as organizations, and doing that with greater intention. I believe we have done it before, but COVID definitely has put it at the forefront, and making sure that we stay accountable to that.
Well, I could not have asked for a better closing answer. I'm the eternal optimist. And the idea that Urban League did make the pivot, recognizing resiliency and the need for service, and changing its structure to better accommodate its community going forward, is really a wonderful, wonderful tribute to what you're doing and also a good message to leave on. So with that, our time is running short, and I'd like to thank all the panelists for their very insightful presentations today. We will now move to Sheri Brown, who will, as she so wonderfully did, close us out and wrap up with some takeaways. Thanks again to everyone. Thanks for attending. We really appreciate it. Sheri?
Thank you, Juliet, and thank you so much for your excellent moderation skills. You're such an expert at this. And thank you, panelists, for your time and preparation for this event. It is the first. Normally, our food for thoughts lasts about an hour and a half when they're in person, so we have enough time to answer a lot of the questions. And we do see there are some really great questions in the Q&A box, and perhaps I will touch on a couple of the responses in my remarks. And so thank everyone for joining. Philanthropy's role is more critical now, more than ever. And I think everyone knows that, and we see that, we hear that, we read that. It is really challenging to think about the long term when you see such despair in the community today, from jobs to homelessness to the food lines and accessibility to these options for food. But know that the Community Foundation of Broward is here to stay and to keep working on these solutions that cannot be fixed overnight. And that's really key to know. We do have endowed funds here at the foundation that enable us to plan ahead and to amplify our financial investments around these issues and to commit to the long-term solutions that work. And we invite everyone to join us in this effort. And as we look at, where are the jobs? Where are there? What do people, what hope do we give people? And I will say the Community Foundation's job is to give hope to the hopeless and to help them understand that there is a brighter future ahead. And many of the jobs, as Mason could likely attest, and I'm probably repeating some of what I've heard him state in previous talks, we're looking at technology industries and automation. There's going to be a mass recareering of individuals who are leaving the hospitality industries and having to undergo training and development in order to find themselves in new workspaces. We know that the construction industry is now on an uptick. It's, I think, one of the only industries that's really increasing as far as employment. And we have to look at companies in terms of how they're structured and how they can create opportunities for individuals. One of the things that businesses can do is you can influence your business network to create and support paid apprenticeship programs as a way to get people back into the workforce. That was a key topic I heard on a national call yesterday of companies really looking internally on how they're restructuring and bringing in individuals into their workforce. And it's a great way for businesses to create their very own talent pipeline so that displaced workers gain skills on the job that get them into careers, new careers, and it gives them the financial means to kind of make it as they get through the training portion. Also, we know that the community needs to get behind small businesses and incubate new startups. That is a key topic of conversation nationally as well. We need to provide a lifeline to help small businesses survive and thrive, and we need to think about creative capitalization of these businesses. Small businesses do create jobs. I mean, that's the foundation of our community. It's the small business sector. So it was really great to hear that, Ted, in your shop, you're looking at how you're helping individuals with home-based work opportunities, as well as home-based businesses are an option. So we have to keep those things in mind. So as you're thinking about the ways that you personally would like to engage around this work or your company, please contact the Community Foundation of Broward. You can reach out to me or our new CEO, Jennifer, or any of our staff, and we stand ready to help you come up with solutions that can really impact the greater population here in Broward County. And on that note, I'd like to end this food for thought and say thank you to everyone who participated. We're so delighted you joined us, and we hope that you will join again for the next opportunity. Thank you.